I extend a warm welcome to everyone who has joined us, our esteemed speakers, our lovely participants, and the people watching us live or watching the recording on YouTube. A very warm welcome to our today's webinar on navigating the AMC pathway. Before we begin, let me take a moment to introduce MSAI. The Medical Students Association of India is India's first and largest nationally and internationally recognized organization with more than 22,000 members across the country. MSAI was adopted as the 100th nation member organization of the International Federation of Medical Students Association. We strive to provide our members with numerous opportunities to empower medical students beyond the classroom to become global health leaders of today and tomorrow. From national conferences, public health projects, international exchanges, and academic webinars like this one, MSAI is committed to helping medical students grow as global health leaders. I am Jay Thakkar. I am the Regional Director for West India at MSAI. I am currently a final year MBBS student at Sri MP Shah Government Medical College, Jamnagar, Gujarat. With that, let's get started with today's session. And to guide us through it, we have two incredible speakers with us to share their experiences. Our first speaker is Dr. Alia Chittoria. She is an inspiringly young doctor whose journey is a perfect example of how passion, dedication, and leadership can come together to make a difference. Having successfully cleared the AMC Part 1 and IELTS, she has consistently gone beyond academics to create impact. From her early years in medical school, Dr. Alia has stepped into leadership roles like serving as the Regional Director Assist for Madhya Pradesh at MSAI. Dr. Alia's research has been published in international journals, and she has represented India at various exchange programs with Indonesia, Thailand, and more. Her appointment by the International Chair in Bioethics, Melbourne, is a mark of trust and respect she has earned in this field. We are honored to have her with us today to share her experience and insight. Our next speaker is Dr. Farhan Fidai. Dr. Farhan is a dynamic young doctor whose journey reflects determination, versatility, and a true love for learning. Having cleared AMC Part 1 and IELTS and holding certifications in ACLS and BLS, he has built a strong foundation of both academic and clinical skills. His academic curiosity has led to four diverse research publications spanning endocrinology, microbiology, and AI tools in patient education. Through every step of his journey, Dr. Farhan has showed that success comes from staying curious, embracing challenges, and sharing knowledge. We are delighted to have you with us. Talking about sharing knowledge, Dr. Alia and Dr. Farhan are the co-founders of Steady Study, a place built by IMGs for IMGs to help the aspirants ace the AMC exam. With this, I hand over the floor to Dr. Alia and Dr. Farhan.
Thank you so much for such an amazing introduction. I mean, I'm really, it's overwhelming because, to be honest, I'll tell you, it was not long enough that we used to be hosts for speakers like us. So it's really amazing to, finally be a speaker at MSI. It's an honor. And I'm really excited for this session. I hope Farhan would like to say a few words before we begin.
No, I just want to thank MSAI for giving us the opportunity and for the lovely introduction. And yeah, we are ready to, kickstart.
Okay, so hi everyone. I mean, introductions are already done, so let's get to it. Okay, welcome. Before we dive in, I'll quickly walk you through the ground rules for today's session. So we want the session to be packed with relevant information, okay, and the kind of information that actually helps. Because I know that about this exam there is not much, information available out there. So we also want to keep it short and focused as possible, and let's quickly go over through a few ground rules before we start. So please keep your questions for the end, okay? We'll have a proper Q&A session. We'll take a very sweet time in answering each and every question. So don't worry, you'll get your turn. And we'll open up the floor for a fruitful discussion with all of you. And second, please mute your microphone so that there's no background noise. It would be great if you can keep your videos on, but yeah, keep yourselves muted. So yeah, let's begin. So Okay, I'll just my screen. All right. Okay. So yeah, first, we all know that AMC exam is a licensing exam to get into the Australian healthcare system, right? But let's clear up one of the biggest misconceptions about the AMC pathway. So many people believe that passing AMC exam directly leads to residency in Australia. And that's not true. The AMC pathway only qualifies you to work as a resident medical officer called an RMO, and it is not a direct route to a specialist training program. So, and that comes into play once you're already a part of the Australian healthcare system. So first you work as an RMO and then apply for individual residency program. So it's not like the match system in the US. Okay. Now let's talk about. So yeah, we all know it's. You can see my screen, right? Okay. So it allows you to work as an RMO, and yeah, that's it. So let's talk about the exam pattern. Okay. First, it's a computer-based exam. So it has 150 questions in total, and out of those, 120 are scored, and the rest, that is about 30 questions, uh, that is pilot questions. So pilot questions are basically the unscored questions which AMC introduces just to test the quality of that topic, okay, quality and difficulty of that topic. So earlier, AMC actually mentioned the number of pilot questions in their official PDF, but in the latest version, they've stopped specifying the number, that is 30 questions, they've removed it. But that doesn't mean that they've completely, removed the pilot questions. It just means that they don't want to highlight it anymore. And honestly, it does not matter that pilot questions exist or not. It's actually the same for you. So you don't sit in the exam thinking that maybe this is the pilot question, let me skip it. No, you have to attempt every question, all 150 questions with the same brain energy. Because your result will be generated if you attempt all 150 questions and there is no negative marking. So you have to attempt every question. And the good part is that you will get 3.5 hours to finish the exam. So once you've marked the answer and moved on to the next, yeah, there's one more thing. You cannot go back. Okay. So you cannot review the previous question. You cannot change the answer of the previous question. So the good thing is the time is 3.5 hours, but then you'll have to manage your time because you cannot change the answer and you cannot go back. And it is a pass fail exam. You all know it's scaled 250 out of 500. Again, another big misconception. People think that 250 out of 500 means that you need to get 60 questions correct out of the scored 120 questions. We get a lot of DMs like this. But trust me, it does not work like that. For example, if you get all the rare theory questions correct, and you miss an important emergency management question. For example, the treatment of pneumothorax. If you get that wrong, you will still fail. Okay. So that's why you need to prioritize what really matters in this exam. And it would be stupid of you to know the histopathology of sarcoidosis, but then not know the treatment of pneumothorax, right? Because as MBBS students, we know how important that topic is. AMC also knows, okay? They're examiners. Obviously, they know more than us. I hope I'm not boring you all, right? You guys are there, right? I mean, can I get a thumbs up or anything? Yeah, okay, perfect. Yes, you guys are listening. Great. Okay, amazing, amazing, lovely. Okay, thank you guys. All right, so this is the blueprint. We have, okay, so medicine 30%, surgery 20%, and then the rest pediatrics, women's health, mental health, ethics, and population health. So ethics and psychiatry holds a lot of importance. We'll get to it in our later slides. All right, so MC Clinical. Now let's touch on the MC Clinical exam. Honestly, I don't even want to stress about this right now because your main focus should be AMC MCQ first. And I think that's our audience right now. So AMC Clinical is a discussion of another day. But since this presentation is about the whole pathway, let's just quickly cover it. So AMC Clinical has a total of 20 stations, and out of these 16 are assessed, and four are the rest stations. So 14 are scored, and out of that 16, 14 are scored, and two are pilot stations. Pilot again, you know, right? The unscored stations. Stations is basically AMC Clinical is an OSCE exam. So it's like you'll be going into 20 different rooms and you'll be, have to do the entire examination and take history and come to a diagnosis, everything. So it's basically a clinical exam, right? You'll get 10 minutes per station, and that's 2 minutes reading time and 8 minutes to actually perform there. And to pass the exam, you need to clear at least 9 stations. So earlier it was 10, now it has been reduced to 9. So that's a good thing for us. Um, One important thing is that the exam is conducted only in Australia. Okay. There are no overseas centers, and the online format, which they introduced before during COVID, that now has been completely stopped. So that's again one thing. Now let's get to the cost of MC. This is the slide which we don't like. Nobody likes this. So yeah. And the cost which I've mentioned here, this is everyone has to face this, right? And just to be clear, what I'm telling you, this is non-negotiable. These are the payments you have to make. You need to get your Epic verification. Epic verification will cost you around, I'll tell you in INR, so around 20,000 rupees. And you will be eligible to do Epic verification after you complete your degree, or at least you have to be eligible to get your degree, right? So we know in India, our college management is like, it actually sucks, right? They take so much time in giving you the degree. So, but you need to be at least eligible to get the degree. So for Indian graduates, you need to complete your internship and then you'll be able to book the exam. That's what I mean to say. Then, yeah, to create the AMC account, around 36,000 rupees. Then AMC fee payment will be around 1,66,000. Then your clinical fee is 1,70,000. So you give your AMC MCQ exam, then you give your AMC clinical exam. Now, if you want to bypass the AMC clinical exam, which we'll get to that later, but if you want to bypass it, there is a pathway called WBA pathway. That's the workplace based assessment pathway. It's basically after AMC MCQ, you get a job in a WBA hospital, you work there, and they'll assess you. And if they feel that yes, you have met their criteria, you will get you will be eligible for permanent registration. That's the general registration. All right. So that is one way where you can skip the clinical exam, but getting into a WBA hospital is tricky. We'll get to that later. But yeah, just to give you an idea about it. So the cost of it is much higher. But yeah. So the total of MCQ and clinical is around 3,93,000 rupees. Now, keep in mind, this is only the exam cost, okay? It does not include your flight tickets, your stay in Australia, or anything like that. And it also does not include the extra expenses. That's the QBank subscription or the coachings for AMC Clinical. All of that is on top of what I've just mentioned, okay? Now let's get to the resources. So this is these are the available resources out there, the common resources which you might have heard of. So yeah, now let's talk about these resources. These are super important. Okay, we have the handbook, we have the question banks, Amadex, M plus X, eMedici, we have the Red Book, books for psychiatry. I'll get to it. I'll get to everything. I'll get to all of these in detail. We have John Murtagh ethics books, and then your recalls. Now recalls is very important. 3 to 6 months of recall topics from guidelines. So whenever you're planning to book your exam, 3 to 6 months of recalls prior to that month, those are very, very important. All right. So now let's get into the details. Honestly, the handbook is old and outdated. Okay. You don't have to fuss over it. It only has a small set of questions. And yes, some of them are even weird or wrong because it's a very old book. Just go through it once or twice, familiarize yourself with the content, because every in every exam you get 1 or 2 questions directly from the book or from its explanations. So it's worth a quick read, but nothing more. Okay. I don't want to, I mean, I'm stressing a lot on this because it's an old book. So you'll get questions, you'll say that, okay, this is outdated, this is wrong. It's all right. It's just an old book. It's just there. You'll have to deal with it. We have the Red Book. Now, this book is specifically for screening. And I've actually made a video on Insta and YouTube explaining exactly which topics you need to cover. You don't need to read the entire book cover to cover, okay? Just the topics, and those topics from the Red Book, they come every month in every exam, okay? So just focus on the screening topics I've mentioned, and they are high yield because every I mentioned, right, every single exam it'll be there. Then we have John Murtagh. Now, please don't try to mug up the entire book. It's around 3,000 pages and it's not meant to be memorized. You need to use it as a reference book only. And if you're unsure about a recall topic after reading the guideline, you then refer to John Murtagh. Okay. So these are the common names which you have heard. That's why I'm, explaining it in detail. Then we have the Q banks. We have Amidex, we have M plus X, we have eVDC. Now, personally, we found Amidex explanations um, better than M plus X because they were clearer and easier to follow. Then, just a second. Yeah. And this has M plus X has more questions compared to Amidex, but honestly, you'll see a lot of overlap between them. So don't stress if you can't finish both completely. You're not missing out on anything major. Okay. Now, e-medicine. Now, this is the newest one. AMC recently partnered with them. And a lot of people think that means e-medicine will have the exact questions that come in the exam. That's not true. Okay. It's just another question bank designed to, get you used to the AMC style questions. And AMC has very clearly stated that they do not provide exam questions to e-medicine. So treat it like another practice resource, not a magic key to the exam. Okay. I just want to mention another thing about John Murtagh because because we get a lot of questions about it every time. So basically, John Murtagh is like Harrison. The quality is not like Harrison, but I'm telling you the volume, okay? And you won't study Harrison for NEET PG, right? So you can correlate it in this way. And okay, then we have ethics, right? So okay, first just let's talk about the QBank again. So for AMC preparation, the best approach is to solve the QBank first and then learn from the explanations and the reverse of how we used to study it in our university. It's basically like that. For ethics, now this is an additional book, USMLE 100 cases. A few cases differ from Australian guidelines, but if you've done question banks like M plus X and Amidex, you'll spot out the difference quite easily. So go through it quickly with the study partner. It shouldn't take around more than 1 to 2 days. And also another amazing thing, we are starting a series on ethics. We are starting a real series on Instagram, basically. So if you follow us there, you'll be able to see how Australian ethics are different from other countries. So yeah, do check it out. I'm doing a little promotion of steady study in between. Okay. I'm not boring you guys, right? I need a little more thumbs up to. Perfect. Okay. You guys are there. Amazing. Okay, great. So psychiatry. For psychiatry, I'd suggest use USMLE Step 2 CK or even First Aid USMLE Step 1. Both are excellent for building your strong theory, especially since as IMGs, we are not used to, case-based scenarios. And psychiatry is tested a lot in AMC. So, yeah, so psychiatry is important. That's why I'm emphasizing on it. Books that we did not use. Again, you will see these two books everywhere in every XYZ YouTube video, in every Telegram group. I don't know why they still share these books. First of all, Anthology of Medical Conditions. It's not even an MCQ book, okay? Just theory and images and not worth it. Then AMC, MCQ, the purple book, very old and outdated. Would not recommend that either. I mean, you'll see people studying it, you'll see people recommending it, but don't do that. If all right. And if you want to listen to the resources part again, you can check out our YouTube video. We have explained everything in detail. Guidelines. So, very important. This is where your preparation should circle around. These are the guidelines which I recommend, which these are official Australian guidelines. Okay, Australia recommends. So yeah, please take a screenshot if you want of this. For general practice, RSCGP is the go-to. Obs and Gynae, SA Health for antenatal care, RANSCOG for pregnancy protocols, for pediatrics, RCH guidelines, for emergency, ACEM, NSW Health, psychiatry, we have RANS-PP, infectious diseases, internal medicine, and most other areas. Therapeutic guidelines, or ETG as you call it, will be your one-stop solution. Okay. So I could not clear NEET PG, so I'm thinking of going to Australia. Farhan, this is your area.
So we get a lot of people who, DM us, they come to us since, I mean, they are all, it's all there because of the social media, and how people make reels around it. They say that, if you can't clear NEET PG, come to Australia. Now, this is a big slap on your face from Batman. There are two reasons for this. First, Australia is a first world country. Okay, we are going from second and third world countries. We hope to go for a first world country. You actually feel, if you rationally think about it, you feel a first world country is waiting for you with garlands in their hands and a red carpet that please come to us. We are ready to pay you in crores. But no one is doing that. Firstly, whoever is telling you that you'll be paid in crores, you remember Batman slapping you because if you earn in crores, you pay in crores, right? You spend in crores. So nothing of that sort is going to happen here. So please, if you are of the opinion that NEET PG, if I can't clear NEET PG, let me just go to Australia because they are waiting for me. They're not. Now, what happens is when you have to compare two exams, you have to take them in their entirety. If you compare NEET PG to AMC, it'll be very wrong to just compare NEET PG to AMC 1. Now, I understand a lot of people on Instagram will tell you that after AMC 1, you'll get a job. It does not work that way. Yes, earlier it used to happen, but at this point now, without AMC2, you can't think about getting a job in Australia. So if I compare NEET PG to just AMC1, yes, NEET PG is the tougher examination. And that is because it covers, even the first and the second year subjects into a very deep depth and takes the nitty-gritty out of it. They'll ask you percentages and everything. But if you take AMC2 and you club AMC 1 and 2 with NEET PG, AMC becomes a burden because the pass rate of AMC clinical is around 21%. Now, does that mean that it's not doable? It is doable. What happens is we are in our country, we are not taught in a way to cater to a clinical examination. So, for example, as Alia said, there will be 20 stations, four will be rest. Now, let me just tell you what rest station means. Rest station genuinely means rest. You just sit there for 8 minutes doing nothing and you pray for your good fortune and you listen to the other people crying in the other rooms about how they are being bashed by the role player. Because the role player is genuinely a good actor who will be crying the lungs out and everything. So that is actually a rest station. Okay. So we are not designed or prepped in a way that we can tackle a clinical exam, which is why that clinical exam is tough. Okay. So this is the difference between NEET PG and AMC. So the next time you slide into anybody's DM, telling them that NEET PG, I want to do NEET PG, I want to do AMC because NEET PG is tough and I can't clear NEET PG. Remember Batman, okay? And remember the slap that we showed it to you. Yeah? Cool? Show some love for Batman, guys. Yeah? Amazing.
Okay.
Amazing.
Okay.
So,
How?
yeah.
Yeah.
So again, Alia will tell you now how to find a study partner.
Okay. So let's talk about finding a study partner. First things first, book your exam. Trust me, you won't take your preparation seriously, and no one will take you seriously because most Telegram groups won't even accept you without an exam date. And see, no one is going to take you seriously. Again, I'll say that thrice, four times, five times. Okay. Next, post it in AMC, MCQ, Telegram groups, or Facebook groups. We have a AMC Telegram group. You can ask there. And when you do, make sure you include details like your country, your exam date, the resources you're using. This helps you connect with people who are at the exact same stage of preparation. If you randomly write that searching for a study partner, you will get around 20, 30 people. They'll say, okay, add me, add me, add me. You have seen in those groups, right? If there's just one message, looking for a study partner or add me in the group, and then there are 20, 30 people, add me, add me, add me. And then you make a group, you chat for around 1 to 2 hours, you waste a lot of time, and that's completely useless. And, nothing productive is going to come out from it. You select three, four people, five people, make a small group, okay? Mention the relevant things which you want, mention what kind of a study partner you need, mention the resources you're using, mention when you want to study, how you want to study, how are you planning to distribute recalls and have a good discussion. That's how you're going to work. So how we used to do it, we if we were preparing, for example, February recalls, right? So we'll just divide 20 questions among ourselves. We'll have a discussion, and during the before the discussion, if I have 20 questions, it is my duty to bring the entire topic. Either I write it down, or I study in a way that I'll be able to teach it from the guidelines, and then we used to have a healthy discussion. That discussion ends up to be fruitful and useful. So yeah, keep your study group small, because the number of people is directly proportional to the stupidity of the group. Okay, keep your group small. The bigger the group, the more chaotic it gets, and everyone will start throwing random advice. Study this resource, join this coaching, do that recall. Oh my God, you did not study these notes. Oh my God, you did not study John Murtagh. Oh my God, I am studying recalls from 2 to 3 years. No need. First of all, people who say that they are doing 2, 3 years of recalls, you ask them the same question after 2, 3 months, that do you remember this topic which you did last month? They will not remember it. Do 3 months, 4 months, 4 to 6 months max. Don't go beyond that. And whatever topics you get from it, do it from the guidelines, revise it, make a choti copy. We have a concept of making a choti copy, right? We are, I guess, all Indian aspirants, we know what is a choti copy. So make that, note it down, revise it multiple times. You need to have a visual memory of your notes. You need to have a visual memory of all the important topics, and then just vomit in your exam. That is the clear forward strategy. Okay. So yeah. Okay. Yeah. This Dr. Farhan, please continue.
So, how to actually ask for help and guidance. Now, there are two types of people that I'm going to describe to you. Okay, so the first person, let's name him XYZ, he'll come to you and he'll come in our DMs, he'll say, tell me everything about AMC. I want to know everything from the cost to the end to how I'm going to get into residency to whom I'm going to marry to everything. Now, see, when you ask for someone's help, the other person will only help you if he feels that you know something, if you have researched about something, if you have put in the effort. Now imagine someone coming to you asking you something about something that is so vast, and you feel that he's just fishing for information. He's going to forget. Why do I put so much time? Why do I invest so much time into explaining something to him when he himself is not serious about it? So when you actually research about something, about stuff that is easily available on the website, for example, the cost. Right. So if I want to ask somebody about something, I will ask them relevant questions. As in, what did you do in the last month of your preparation? What mistakes did you make during your preparation? Not something like, tell me everything about AMC. And when you come to me and you ask me a question like, please tell me everything about AMC, you know what I actually feel? I really feel like Batman slapping you. Because that is not the question you should be asking me. That is something that you should be researching and asking me relevant things. But then I'll, describe the other person who will actually come to me. Let's also name him, XYZ. And he says that, I'm already familiar with the basics of the exam and the available resources. Could you help me so we can work together to decide the best plan for me? And when I see this person in my heart, with all honesty, I just want to, yes, I want to hug him because he is asking me the relevant question, something that actually means something. I know that if I help him, he's going to pull through. The first person, I know he's just fishing for information. So I'm not going to waste a lot of time. And I'll be very honest with you. Most of us have the same mentality because no one here is free. For that matter, if you message Jay, if you message Jay and you ask him something, related to anything, if you tell him, tell me what MSCI is, he's going to be very irritated. Yeah. He's going to tell you that, bro, research something about the foundation you want to, then ask me relevant question as to how we can help you. So that is the thing that, we expect everybody to do. That show your honesty, show your efforts into something and then ask for help. Yeah. So, yeah, this is how you actually ask for help. Now, if you ask me, will I get a job after AMC 1? You won't.
Yeah.
So again, Alia will tell you why you won't.
You aren't going to get a job after AMC 1, and while that sounds harsh, it is the truth, okay? Because with the competitiveness of AMC increasing day by day, competition is increasing everywhere, right? Whether it be USMLE, whether it be PLAB, we all know that how UK is saturated. AMC is also a tier one country, right? They are not just sitting there that, okay, guys, come to Australia, have a happy, lavish life. Oh my God, you're going to earn crores, like Farhan mentioned before. So most academies, I don't want to name anyone, but they make you believe that you're going to get a job instantly, and life is going to be crazy. That's not the scenario. Okay. They need experienced doctors because there are a lot of candidates with past AMC 1 results. The competition is insane. Okay. AMC clinical booking is another task. So instead of waiting for a job, you know, start preparing for AMC clinical because that is the only way to move ahead. They want to test your clinical acumen. AMC wants experienced doctors. They don't want you to come into their country and they'll be teaching you, they'll be spoon feeding you that okay, this is how you manage a patient. They want you should know everything. Come to our country, serve our country. That is what they want. Okay. So, yeah, I think let's move on to the lecture. Uh, Farhan will be taking a lecture on a heavily tested high yield topic. So it's going to be a short lecture so that you will get an idea about the kind of um, the pattern of AMC and the kind of questions that is being asked. So yeah, over to you, Farhan.
So I'll just share my screen.
Mm, yeah, Farhan.
Is the screen visible? Perfect. Okay. So, one of the maternal infections in pregnancy, I'm going to teach you and also I'll tell you how and why relearning and unlearning is important. So, let's take chickenpox. Yeah. So, how AMC is going to trick you? Everyone knows what chickenpox is. This is not what we do at Steady Study. We teach you exactly from the guidelines what you require. We make them into flowcharts so you can remember everything. Now, if I talk about chickenpox, the first thing that you need to know is that if a pregnant woman is exposed to chickenpox, you have to check if she had chickenpox in childhood or no. That is the first step. That is your next step. If the answer to that is yes, that she does remember, you will reassure her because she will have enough antibodies to protect herself and the baby. Now, what if she says no, or if she says that she's unsure about it? In that case, you have to perform a varicella serology for IgG. Now, a lot of candidates I've seen that they actually memorize this part, which I don't want you to. I want you to understand what IgG and IgM is, right? So when we do a serology, what we basically are doing is we look at two things. One is your IgG and one is your IgM. Now, IgM comes first. You can remember this from Mahatma Gandhi. In Mahatma Gandhi, M comes first, G comes later. So M comes first. Now, what does M mean? M either means an ongoing infection or a recent infection. She was recently infected. IgG means either the two things. One is either it's a chronic infection or that she has immunity, might have been vaccinated against it. Yeah. So what if a question tells you that that the lady is IgG negative and IgM positive? What would that mean? It would mean that there is an ongoing acute infection going on. The word being acute infection that is happening. But if she says that the IgG is positive and the IgM is negative, that means that it's a chronic infection or that she is immune. Usually this means immune. If they were to give you chronic infection, for example, in cases of hepatitis C, they give IgG positive and IgM positive, both positive. That means that there is a chronic infection. Now let's take into consideration chickenpox. Now a lady came to you, she told you that, hey doctor, I'm pregnant. I'm a teacher. I was exposed to someone having chickenpox. Now I'm very scared. Will something happen to my baby? So you asked her, did you have chickenpox as a child? She says yes. You send her home, you reassure her there is no problem, you are immune. If she says no, That is the point when you do a serology for IgG. Why IgG? Because you want to check for immunity, right? Now, if she tells you if the IgG is positive, it means that the patient is immune. Reassure her, send her home. If it says that the IgG is negative, here is where the game of words comes in, and here is where people find AMC tough because they have to dive deep into the guidelines. What the guideline says is that if the lady is coming to you within 96 hours of exposure, you have to give an immunoglobulin. But if the stem is telling you that she's coming after 96 hours, that is when you have to either give her acyclovir or valacyclovir. In a nutshell, you have to give her antivirals. So within 96 hours, immunoglobulin. After 96 hours, antivirals. Yeah. Now, what would happen if they tell you that the woman has developed chickenpox and now she's worried that, I have chickenpox. What is the management for my baby? Is my baby in danger? So what you have to do is you have to understand what the guideline is telling you. It says that if the symptoms, for example, the rash develops at more than 7 days before delivery. So for example, let's take an arbitrary number. Yeah. Let's take that the date of delivery is 20 November. If she's developed it on the 12th, which means that more than 7 days. So this is 8 days back. In this case, there is no immunoglobulin requirement. You do not need to isolate the baby and you can encourage breastfeeding. What if the test stem tells you that the symptoms have developed at less than equal to? So again, in AMC, this equal to sign is very important because AMC is very notorious. If it's 20, they won't give you 11, or if it's the second day, they won't give you 22. They'll give you bang on seventh day. They'll give you 13. They will give you 13. So you need to know that equal to is involved where. Yeah. So if it is at less than equal to 7 days before delivery or 2 days after birth. So either from here till here. In that case, what do you have to do? In that case, you have to give the newborn immunoglobulin immediately. You have to give the newborn immunoglobulin immediately. Encourage breastfeeding, but again, isolation is not required. Now, if the symptoms are developing from more than equal to 2 days, so that means from 23rd up to 28 days. In that case, if the neonate was born at less than 28 weeks, or if the birth weight was less than 1,000 grams, in that case, you will have to give immunoglobulin, right? So if the neonate was at less than 28 weeks birth, or if the birth weight was less than equal to 1 kilo, only in that case will you give the baby immunoglobulin. Perfect. Is everyone in sync till here? Have you understood what I've tried to tell you? Yeah, come on. Cool. Amazing. Perfect. Yeah. So how will you manage the pregnant woman? That was the management of the baby. How will you manage the pregnant woman? So if they tell you that the chicken pox is without complications, and if the rash has developed at less than equal to 24 hours, you will give her an oral antiviral and that's it. But if she's coming to you after 24 hours, there is no treatment required. You reassure her, send her home, ask her to come for a follow-up ultrasound within 5 weeks. So the woman is pregnant. You want to check if there are any complications in the baby. You tell her, go home, come in 5 weeks to me. I will do an ultrasound to check if the baby is okay or no. Yeah. So this antiviral, you have to understand, in virology, you have to understand the antivirals that we give are not actually to kill that virus. It is to prevent transmission. So the transmission, if you give oral acyclovir, it is only effective in the first 24 hours. After that, even if you give it, it won't actually matter. So if she's coming to you at less than equal to 24 hours, you give her an oral antiviral. If she's coming to you after 24 hours, reassure, send her home, call her in 5 weeks, we'll do an ultrasound for you. But if the chickenpox has developed with complications, in that case, you have to give an intravenous antiviral medication. Okay. Now let us solve some questions to see how AMC will actually test this knowledge. So question number one. Robert and Janet are in your clinic for consultation, and Robert complains of malaise, mild headache, and a generalized rash in the form of both intact and unroofed vesicles, as well as macules and papules. Okay, so you need to understand that there is a certain Robert who has these symptoms. And 3 weeks ago, Alan, who was their 7-year-old was diagnosed with chickenpox. So here in your mind, you should understand that, okay, this is testing my knowledge on chickenpox. The box should open in your mind. Now, based on the history and appearance of the rash, you have established the diagnosis of chickenpox for Robert also. Now, Janet is a 13-week pregnant lady. And now she is concerned if the infection can affect her and her baby too. Janet is not sure. She is not sure if she had chickenpox in childhood. Which of the following is the next step? So AMC does this. Next step, best step, most appropriate step. You have to read the last line first to understand what the question is asking of you. Now they've asked me the next step. Now these are my options. Start her on oral acyclovir, give her varicella zoster vaccine, give her immunoglobulin, arrange for varicella zoster IgG status, start her on oral famciclovir. Come on guys, your answers in the chat box. I see a lot of D's and I'm very happy to see a lot of D's. Yes, exactly. So when I saw this question, in my mind, I opened my flowchart. The first thing that I saw is that this question is about chickenpox in pregnancy. The second thing I know that the next step that I have to do is ask the lady if she had chickenpox in childhood, which the question has already told me that they have done. To which she said she is not sure. So we are here. We are here in the flowchart. So the next step is perform varicella serology for IgG. Yeah, cool. So every one of you was right. Now let's get on to the next step. Next question. Martha is a 42-year-old lady who has developed a rash characteristic of chickenpox today. Now, just 5 days prior to her so today, 5 days prior to her pregnancy date. So her pregnancy date is for 5 days later. Which of the following is the most appropriate management to prevent neonatal chickenpox? Antiviral therapy, consult an infectious disease expert, varicella immunoglobulin to the mother before delivery, varicella zoster immunoglobulin to the baby after delivery, follow up for early onset sepsis. Come on, guys. Your answers in the chat box. I see C, C, D. Come on, guys. I'll give you 1 more minute and then I'll answer the question for you. When you have these questions, you should not feel what I feel is the right answer. You should always think as to what AMC wants as the right answer, what the guidelines are looking for as the right answer. So the correct answer is D. And when I was preparing, I also always had the urge of marking C, but the correct answer is D because what is Australian guideline telling you? The guideline is telling you, so now we are here. Now we are here in this column, right? Here, sorry, I'm sorry, we're here in this column. That it's at less than equal to 7 days. So 5 days, you know there are only 5 days left for delivery. What do? You give the newborn varicella immunoglobulin immediately. You give the newborn. So before delivery, there is no newborn. The newborn is after delivery, right? So C is the wrong answer. Not before delivery. You have to give it after delivery to the newborn. Yeah. Now, these flowcharts that I've made are not exactly given in the guidelines. We have made our notes in a way that the guidelines are all in one place and made it easier. So the next step, the best step, and the most appropriate step are there for you. Yeah. Now let's move on to the last question for the day. A 30-year-old lady comes to your clinic at 26 weeks of gestation. She's worried as she came in contact with a child having chickenpox 24 hours ago. You checked her pre-pregnancy IgG level, which was negative. So 24 hours, negative. She missed getting vaccinated for chickenpox before pregnancy and has no symptom. What is the next best step in her management? No action because she's asymptomatic. Check IgM levels. Give varicella immunoglobulin. Check IgG levels. Give vaccine for chickenpox. Your answers in the comments, please. I see E. I see an E. And if you answer E, Batman will slap you because it's a live vaccine. You can't give live vaccines to a pregnant lady, right? C. Amazing. So whoever's answered C, perfect. Now where are we in the flowchart? So you know that she's come to you as she came in contact with a child having chickenpox 24 hours ago. So you have 24 hours. You know she was negative for IgG. Where are you in the flowchart now? You are here. So you checked if she had as a child, you did the IgG levels, the IgG levels were negative. Now comes your game of numbers. So she is within 96 hours, which is why we give the immunoglobulin. What if this time would have told you that she's coming to you 5 days after? In that case, you would have given an antiviral, an acyclovir. So AMC is not as tough as you think. You have to unlearn and relearn. For example, if I give you an example of HIV, back here in India, if there is a mother who's affected with HIV and she's given birth, you still ask her to breastfeed. But in Australia, breastfeeding is contraindicated if the woman has HIV. So this is where you have to unlearn what you already know. Yeah, and there are many examples throughout the guidelines. But if you study consistently, if you are well versed with the guidelines, and if you have a good mentor, you can easily pass the exam. So this was all about the tiny lecture that I wanted to give you. Now, if you have any questions, we are open for them. If you want to talk to us, we'll just quickly take some questions. Amazing. This is the first time we have had no questions. Either we were very clear or we were so boring that you all fell asleep and Batman will come and slap us then. Is it available on YouTube? I mean, I think Jack and yeah, I think
See, guys, I just want to say that AMC pathway, AMC journey is really long. You might feel like you're alone, and you might even feel like you're losing faith at times. But trust me, you're not. We are here with you. You're not alone in this journey. Steady study is always here to support you. So reach out whenever you need help. You can check our Instagram. We're on YouTube, and you can DM us on WhatsApp. You can join our WhatsApp groups, our Telegram groups, and don't forget to connect with us. We're everywhere. Wherever you are in your journey, we've got your back. Okay. Uh, I think we are getting questions. Okay. I've completed my internship in May, but I've not received my degree yet. Can I still book the exam? Yes, I mentioned it earlier, right? Our system is quite slow. So yes, you can. There's this thing called alternate graduation document where you just get a letter from your college stating that you are eligible. It's just that the degree, you're not getting the degree because of delay from their end, and you are eligible to get it. So yes, you can. Alternate graduation document is your solution. I think I've answered your question. Can't we give AMC during internship? No, because this is for Indian students, right? If FMGs are here, I think your criteria is different. So for students who are doing MBBS from India, you need to complete your internship because for us, internship is included in our degree, right? After we complete our internship, we get our degree. We need to be at least eligible to get it. When is the right time to start preparing for step one?
internship,
Now. Now.
internship. No, no,
Start
internship,
now.
internship.
I mean, I want to ask you where you are in your preparation. I mean, which stage are you in? Third year, final year, or internship? Where are you? So, can you sometimes tell about guidelines in Australia?
What
Yes,
about, I
definitely.
mean,
Huh.
what about the guidelines? So the guidelines in Australia are guidelines that Australia made, which are guidelines by Australia for Australia. I mean, Australian guidelines are gold standard, right? You have to, if you want to pass the exam, you need to read about you need to read about a topic from the Australian guidelines. So you have to search for them when you read a topic, type the name of the topic, look for Australian guidelines, and they are basically research papers. There is no book that they'll give you. They're all research papers. You have to read the research papers. And if you want help with that, you can always contact Study Study.
Okay. What to do after AMC one before doing AMC two? Apply for jobs, but prepare for AMC two, right? I mean,
I mean, if you,
what
after this
exactly is your
session, if you are
question?
still asking us that, before
Yeah, I mean, start
you
preparing
get
for
a
AMC
job.
too,
Yeah,
right?
just prepare for AMC2.
What's the name of the medicine that was shared in starting? The
So you are asking about John Murtagh
John
basically.
Murtagh. That's John Murtagh. It's not similar to Harrison. I was just comparing it
Look,
volume
it'll
wise.
be a shame to compare anything to Harrison or
Exactly.
even Davidson for that matter. So no, nothing is comparable. We just gave you a set example that you won't be studying Harrison to crack NEET PG. Similarly, you don't need to study John Murtagh for AMC. But again, it is not even close to Harrison. Harrison is the Bible of medicine.
What are the resources we should see and when should we start? Again, internship. But yeah, see, if you are in, your third year, second year, final year, first I'd say clear your basics, okay? These are MBBS years. You need to build your foundation. All right. Then you'll be able to understand the resources that are available for the MC exam, right? So first build your basics, your foundation should be strong. Even though you're studying Indian guidelines for now, a lot of things are similar, and whatever changes they are, you will study eventually. Okay. So yeah, I guess if AMC oriented preparations should start during your internship. I am audible, right?
Yeah.
Huh. AMC oriented preparation should be during internship, but before that, you need to build a strong foundation. I mean, obviously, you
So
cannot skip your
I'll give an
university.
example. Yeah, there was a candidate who came to me and he told me that AMC only tests final year subjects. So why do you emphasize so much on building basics? So I'll give a very simple example. To that, I responded to him. I asked him, "Can you tell me what aortic stenosis is? What kind of murmur aortic stenosis has?" He said, "I don't remember." Now, two things that are wrong here. Firstly, you don't need to remember what aortic stenosis is because if you know physiology, you don't need to actually remember that it's a systolic murmur. Yeah, because to that I asked him, "Can you tell me where the aortic valve is?" And he told me that it is on top of the heart. Now, if this is your basic, you can't expect to clear an aortic stenosis question when it comes for the Australian Medical Council exam. What I expect of you is that you know that the aortic valve is between the left ventricle and the aorta. And when the left ventricle tries to pump blood into the aorta during the systole, the aortic valve is the gateway between them. And if it is thick, if it is stenosed, that pumping of the blood from left ventricle to aorta is actually tough. So it is a systolic murmur. You don't have to remember this. You need to understand this. Because if you have to remember that it is a systolic murmur, there are so many things about aortic stenosis you need to remember further. For example, there is syncope, angina, dyspnea. You can't remember everything, right? Even the symptoms you have to think that what could happen if the aortic valve is stenosed. Yes, there is no blood going from the left ventricle to the brain, so there will be syncope. Then there is less blood coming back, so there will be angina. There is less blood going to the lungs, so there is dyspnea. So this is physiology. This is not medicine that is happening, right? The magic is when physiology, pharma, path, and micro, when they come together, that is where the magic happens, and that is medicine. So next time, don't even think that you don't require physiology or pathology for your AMC exam. You do require them. To what extent you have to see based on the questions that are actually required for the AMC exam. I hope that answers that.
There is a pathway where if you give PLAB 1, PLAB 2, and AMC MCQ, you bypass the MC clinical. Would you recommend this pathway? First of all, there is no such pathway, what you mentioned. See, if you give PLAB 1 and PLAB 2, then there is a different pathway called the competent authority pathway. So via that, you can, verify your exam. So basically to Australia, um, it actually the PLAB exam is credible there, right? So you have to show Australia that, okay, we have given PLAB 1 and PLAB 2, and we are eligible to work there. So please consider us. So that is basically a competent path. AMC, MCQ, and AMC clinical is the standard pathway. You're going to Australia by giving the Australian licensing exam. Okay. So the scenario which you mentioned, so the person might have given PLAB 1, PLAB 2, and he might have he might have good experience.
and then he gave AMC MCQ, and he got a job after giving AMC MCQ. So this is not a pathway as such, right? Either he might have gone through the competent pathway or from the standard pathway. Now, again, if you give AMC MCQ, you can get a job directly, but then you will only be getting provisional registration. And then you can get into the Australian healthcare system. You work there. You will have to give AMC clinical eventually to get general registration. I hope that is clear. I mean, Cheryl, you got the point. You cannot bypass AMC clinical unless you are getting into a WBA program. So that is a different thing. That is also basically after your AMC MCQ, you are applying for a job and you get into a WBA hospital, you work there, and then they assess you that, okay, yes, this person has clinical knowledge. We can, allow him to work and bypass the clinical exam. That is a different pathway. AMC MCQ,
And
AMC
again,
clinical is a different pathway.
I want to make this thing very clear that if you're thinking about WBA, let me burst that bubble for you. After AMC 1, you are not getting a job in a normal hospital that is not even WBA accredited.
Exactly.
You think you will get a job in a WBA accredited hospital where people who have only those people get jobs after AMC 1 who have years and years of experience, 7, 8 years of experience post residency. They are getting jobs in WBA accredited hospitals. At your point, there is no chance that you're going to get a job in a WBA accredited hospital. So if you're getting into this pathway, please fixate on the fact that you have to give AMC clinical. And it is actually very saddening that when people think about USMLE, no one is even thinking about after USMLE 1 will I get a job, or after PLAB 1 will I get a job. But they enter the Australian pathway because they've seen reels saying after AMC 1 you'll get crores of rupees and job. Bullshit. It used to happen, it is not happening now.
I think everyone have seen those ads where they say,
Yeah.
after AMC MCQ, you'll get a job. And you just thought that, okay, let's join this session and they'll just tell how to clear AMC MCQ and we'll just clear it and go to Australia.
My
Guys,
1 crore is
no.
waiting.
Exactly. Okay. And see, one more thing. Okay. Why are we emphasizing so much on giving AMC clinical? Because the audience here are recent graduates or not even graduates, right? I think we have third year, final year internship uh, students here, right? So for you guys, it's great that you're thinking to get into the Australian system ASAP. You're not waiting to, complete your PG and then think about Australia. That is good. But then it is difficult for you because you will have to prove Australia that you have the clinical acumen. You know how to work in a hospital, and that too a hospital which works on protocol basis. It's not like you can, prescribe anything and just go away. Okay. It's a tier one country, guys. You have to take it seriously. And they will only take serious candidates in their country. Okay, what was your study pattern like? Okay, everything related to the study pattern and resources is already on our Instagram and YouTube. So guys, I would recommend you check those out because I think we are getting late also, right? So everything related to that, you can check out on our pages or you can DM us and we'll get to you. Is research work as important for AMC as it is for USMLE? See, research work is basically to improve your CV. Okay. You can polish your CV however you want. But it's like for USMLE, there is a lot of emphasis on doing research. For AMC, it's not that emphasized yet, but yes, it will, improve your CV.
So I'll tell you the difference. When you apply for US, you are applying for a residency, which is why you need a
Exactly.
good CV and you need your research. Now I'll tell you where research is going to be important. Initially, after AMC clinical, you will be applying for a job. You will work for 1 year as an RMO and then you'll apply for residency in Australia. So when you're applying for residency, that is when you'll need research. Yeah. So that research can also be done in Australia. It should not be that you are doing research work and your studies is going for a toss. I was doing a meta-analysis. That meta-analysis won't be worth anything if you don't clear a clinical exam. Yeah.
Exactly. I mean, your main focus should be, to strengthen your basics, to clear your exams, and then keep polishing your CV.
So Ali has asked, suppose if I find pneumothorax important, how do I study this topic? From John Murtha or own notes? From the Australian guidelines, which is where? AMC
Steady
steady
study
study.
notes.
We we will always tell you to study from steady study because everything is in one place. So if you can check us out on Instagram. Our sample notes are already there on YouTube. If you want after the lecture, you can DM us asking the resources. This is not the platform for that. Anyone who's
I
interested in preparation, you can always DM us later.
Yes. Ayushman has mentioned he's third year student. What is the best time to start internship? We just mentioned that. You're in third year again. Strengthen your basics. Any thoughts on OET instead of IELTS?
So I mean, you can. It's the more expensive exam, and I mean, me and Alia, we were confident enough with our English, so we opted for IELTS. We prepared for a week and we gave it. But again, OET is the easier exam. It's just for it's catered towards medical graduates. So yeah, in the passing you require a B to pass, if I'm not wrong. Yes, you require a B to pass, and in IELTS you require a band of seven, with seven in each of the four domains that are tested, which is speaking, listening, writing, and reading. I think IELTS is a pretty doable exam if your English is good. But again, if you're not confident enough, don't waste, an unnecessary attempt. You directly go for OET and clear it.
Yeah, I mean you can prepare for like 2 weeks, 3 weeks. It depends on where you are in your
Yeah.
preparation.
I think YouTube is the best resource, okay, for any English exam preparation. Just go for YouTube.
How much duration is ideally taken to prepare for the AMC pathway? So for AMC MCQ, I'd say 5 to 6 months. And it also depends on various circumstances, right? If you're working, if you have a job, or if you are, completely available to study full time, it all depends on the factors. And to be honest, when you finish your first read, that is when you actually know that how much time you're going to take to, finish the AMC MCQ syllabus. For clinical, again, at least 6 to 8 months of preparation is needed. I mean, we wouldn't recommend to jump into booking the clinical exam without even familiarizing yourself with the syllabus because it's a tougher exam, like Farhan mentioned before, and it would be a shame to waste an attempt. So yes, um, did you find AMC Australia better destination than the States? Or was the exam better? What benefits did you find in this one? I think Farhan would like to answer this because he has studied for every possible exam out there. He studied for USMLE, studied for PLAB, and then finally decided to give AMC.
So I'll tell you, I firmly believe that there is a time for everything. When I started my USMLE preparation, again, I had no, guidance. No one of my senior had done that. So uh, I started in the final year, and by the time I could actually gather information and was ready, it was already internship. Now I know I have to give AMC one, then go for my clinical observership there. I felt I was getting late, and I'd seen the best of people with the best of CVs still not matching. And that journey takes a lot from you, including financially. People end up spending a lot of money from USMLE step one, two, and the major money goes into observerships and the things that they do there. So it reaches up to 40-45 lakhs, and still they don't get matched. For that, they apply for another 6 months for a research position. I think I was not cut out for that because I was too late. Maybe if I was in my second or third year, I would have still gone for it, but I was too late. Regarding UK, I never found UK fascinating. Australia, I have relatives in Australia. I have been to Australia twice, and I feel it is a beautiful country, which is why I opted for it. My dad has lived in Australia for 9 years, so I had that bias in my mind. And the more I researched about Australia, the greater I fell in love with. And again, after Team India, I was a big fan of the Australian cricket team, so that also was a bias. So yeah.
My college is listed on the World Dictionary of Medical Schools, but not on the ECFMG website as of yet. Is it okay? No, it's not okay. Please mail them. Please tell them that your college is listed on WDOM, so make that update. Tell them to make that update because if you select another option, I mean, how will you select your college on the ECFMG website if it's not available there, right? You cannot select any other option. And even if you do, it won't get verified. So unnecessary your time will get wasted there. You need to make
And
them.
there will be some people who will tell you, okay, Abhi, select this college, and then later on you can email it. Don't do that,
Don't do
because the
that.
first thing, yeah, the first thing you click, at some point of time you will have to go to that country for your document verification. That is where you'll be caught. So don't get into that BS. Email ECFMG. They are very helpful. They'll get you sorted. If you are on WDOMs, they'll get you sorted. Don't worry. I had that same problem. I got it sorted.
How to study properly, like from where to first study topic and then what to do. Again, follow steady study. Instagram, YouTube, Telegram, WhatsApp group, join everything. Half of your doubt, I guess 75% of your doubts will be cleared. And then DM us. Do your research and DM us. If you don't do your research, Farhan will send you that Batman slap. Okay, what's your say on observership in Australia, taking in consideration internship and bond services in government colleges, which don't allow leaves? Uh, for bond, I would say complete your bond and then do anything, okay? Because your documents, they have your documents, and you will have to eventually either pay and break the bond or do it. So get that bond thing done, okay? I cleared my bond. I just finished my bond last month only. And about observerships, Farhan, can you please add?
Again, observership as for now, at this point of time, you won't even get it because Australia is not as established in observerships like the US. So even to get an observership in Australia, the first requirement that they give is a PR, a permanent residency, which we don't have. So Australia is really stupid in that way. So, getting an observership is very tough. And even if you get it, it's very expensive. It's like really expensive and you don't require it at this point.
Then there's
This
another
point,
question.
yeah.
Is it useful? Okay, it is useful in the sense that you will get into the Australian healthcare system. You will be familiarizing yourself with the system.
Reference is
So,
mainly reference,
exactly.
only a reference.
And
Yeah.
apart from that, I wouldn't say it's necessary. If you have an opportunity, go for it. But I guess you don't have to, focus so much there. If you prepare for AMC clinical, clear it, you'll eventually get a job there, right? Then why get into observerships? I mean,
What are the
you should
major
get paid.
disadvantages of AMC pathway and healthcare in Australia? Major disadvantage of AMC pathway is that, um, it can get very confusing and dark at some point because, a lot of people are still not preparing for it. So you'll feel very alone, but, you can always connect with us for that. So that is a disadvantage. Apart from that, every healthcare system has its own disadvantages. For example, Australia is mostly a government healthcare and a lot of private as well. It's not like the NHS where everything is government funded. So you will always find a doctor. But as such, I don't see any disadvantage there. Yeah. I mean, it's beautiful. Just like the Indian healthcare, it's the only disadvantage in the Indian healthcare is for the doctors, I feel. Because we are overworked, we are overstressed. But India is such a beautiful country that even at midnight, at 2 a.m., you want a doctor, you always find one. Yeah, so India is beautiful in that way, and even Australia is beautiful in that way. So there is no major disadvantage I see. It is your own personal, these questions are very subjective. What might be a disadvantage to you might be an advantage to me, and vice versa. So it's really tough to, if you can ask a clearer question, maybe we can address that.
Okay, there are a lot of questions related to the resources, guys. Please check out our Instagram and YouTube
We
because
have our
I
own
guess we are
resource.
getting late. We have to wrap up as
Yeah,
well.
we have our own
Let's just
resource.
take.
You can DM us for our own resource. We'll tell you how and what it is. We are also starting our own video lectures, so you can DM us regarding that.
Will the gold standard textbooks I'm using for my university exams also be helpful in building a strong foundation for AMC preparation? I mean, you cannot ignore your university exams, right? You will have
And
to study.
gold standard is if your gold standard is giving you a good base and understanding of a topic, you can study from anything. You can study from anything as long as you know the basic. You know what preload is, you know what afterload is. Preload and afterload is going to be the same in any textbook. So you can build your basis from anything, but then the management part of it should be from the Australian guideline. You can't, there is no maneuvering around that. So I think we would love
God.
to answer questions all night.
Oh my God, so many questions. I have 1 year bond post MBBS. How should my timeline be planned according to you? You have 1 year bond. Uh, join your bond and make sure that there's not much workload given to you. Try to escape as much as you can. Study for AMC MCQ, clear AMC MCQ during your bond, complete your bond, join some light hospital, or don't study for AMC clinical. That's how you can finish it. That's what I did, and that's what I'm doing right now. um, how a residency program situation in Australia. Again, first we need to get into Australian healthcare system, work as an RMO, get glowing letter of recommendations, and then get into residency program. You need to show that you are interested in that. There are pros and cons to it. It's not like the math system in the US. First of all, my college is registered. Okay. Between AMC, MCQ, and AMC Clinical, what are you supposed to do? Prepare for AMC Clinical and join
Work.
any hospital. Yes, work. My college is registered on does not have sponsor notes. They have applied, but
Alia,
it takes long. Yeah.
I think we should now wrap up. Yeah,
Mm-hmm. Yeah. I guess we have
we
answered most of your questions.
yeah.
Anything else you all can DM us on Instagram or WhatsApp. We'll reach out to you. Don't worry. We will answer all of your questions. But I guess we have answered most of the questions, right? Okay, guys. It was lovely meeting you all. Can you all turn on your cameras? I want to see your lovely faces, please. That would be lovely. We'll take a photo. Fran, can you stop screen sharing?
Oh yeah.
Thank you so much, Dr.